I wanted to pick up on this comment because this is something that I see in my clinics a lot, but also I sense that there's a lot of worry that your daughter is having prolonged periods and she's vomiting. A normal ultrasound scan must not be taken as gospel that everything is normal and that there's no underlying cause. A normal ultrasound scan means that at least one investigation is done and should mean that the doctor continues to find an underlying cause with the symptoms that your daughter is showing. If you ever experience nausea or vomiting during your period, it's natural to worry that something is wrong, but it is a common symptom. We always have to think about pregnancy if you are sexually active and you are vomiting, even if you are having a vaginal bleed. The thing is, hormones are usually the cause for most women and girls who experience nausea during or before their period. It's due to a hormone called prostaglandin, which circulates around your body during your time of the month. It can cause symptoms such as nausea, diarrhea, and headaches. In some cases, premenstrual syndrome, PMS, or premenstrual dysphoric disorder, PMDD, can also cause nausea and vomiting. Premenstrual syndrome typically begins a week or so before your period. Your breasts might be sore, you might become constipated, you might get back pain, headache and bloating, or swelling might also occur. Emotionally, you might feel anxious or irritable. Some women go through mood swings or find themselves crying for no reason. You might even have trouble sleeping. Painful cramps can also occur with nausea. If you suffer from dysmenorrhea, which is actually just a big word for painful periods, you may experience nausea, strong pain in your back, your stomach, your legs, your hip, your pelvis. They can also, all that pain can make you want to throw up. And that is all because of the bleed that you're getting on a monthly basis. However, there are two causes of nausea during your period that can be quite serious and should be taken seriously. The first is endometriosis. This is when cells similar to the lining of the womb are deposited outside in the pelvis, and every time that you're having a period, more endometriotic lesions are deposited, and also they developed in the pelvis as well. This causes heavy, painful periods. Even in some cases, the pain can be before a period starts. And sometimes endometriosis is so painful that it can cause symptoms of nausea or vomiting. Therefore, a normal ultrasound scan does not rule out endometriosis. So although the scan might be normal, do not stop looking for the cause for the right management. This is sadly why it takes us an average 8 years to diagnose endometriosis. And regardless of the age of the woman, the NICE guidance suggests that a gynae referral should always be made, even if the ultrasound scan is normal. Pelvic inflammatory disease is another serious cause of nausea during your period. Most women get this when bacteria has moved from the vagina to the uterus, ovaries, and the fallopian tubes at the top. And it can cause cramps, pain during sex, pain during urination, and pelvic pain. In most severe cases, you can get fever or chills, but the symptoms, as you can see down below, you can get almost like a yellow, green, or an odor or a discharge from the vagina as well, and it can cause nausea and vomiting. How to control the nausea during your period? Well, there are so many advices out there online. But if you do find yourself feeling nauseous during your period, there are a few very simple things that you can do. Sometimes dealing with the underlying pain might actually help the nausea. So painkillers such as mefenamic acid or something to help with the heavy periods such as tranexamic acid can really help. A TENS machine, hot water bottle, and rest can also be a thing that really helps. Make sure that you're drinking plenty of water and sticking with a bland diet. Ginger may also help some. Some of my patients absolutely swear by drinking peppermint or chamomile tea. If none of those things help, then try taking an antacid or having a chat with a doctor about using a long-acting reversible contraceptive like the combined pill or progesterone-only pill can also help. Taking anti-nausea medication needs to be discussed with your doctor, and I find in some cases it does help, especially in the severe circumstances, for my patients to just take it ad hoc when they are feeling the nausea. The most important thing is, I cannot emphasize enough how important it is to have a symptom diary. Keep going back if the symptoms are worsening or they don't settle. And sometimes you have to be the detective for your own body. Keep going back to the doctor. You are not being a nuisance, but advocating for your gynecological health.